Hello and welcome everyone. Thank you for joining today's presentation from the Health Connector, where we will present an overview of the Health Connector and resources available for those in need of health insurance coverage, including new savings. You have joined Need Health Insurance? New savings are here through the Health Connector presentation. We have a number of participants who have signed up, but we will get started at 9:30 as scheduled. I'm Erin Ryan from the Massachusetts Health Connector. I will be facilitating today's session. I'm joined by my colleagues, Kayla Sherry, Melissa Montrand, and Nikki Conti, who will be presenting today's information, and we are here to help answer any questions you might have. I would like to take a moment to thank elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and our congressional delegation. Before we get started, just some information about our presentation format. Everyone's audio has been muted and video has been disabled. The presentation portion will last approximately 30 minutes. Then we'll have time for a question and answer period. If you would like to ask questions at any time, please use the Q&A functionality. We will be monitoring your questions throughout. But please do not disclose any personal information or protected health information when you ask your questions, as others on the call may be able to see what you have written. If you have a specific personal scenario that you want to discuss with someone, we'll be providing contact information for the Health Connector's Customer Service Center and instructions on how to find help from a local navigator. We will be recording today's call. Following today's meeting, you'll receive an email with the presentation along with a brief survey about the information we've shared, so there's no need to take detailed notes. Please complete the survey if possible, as we'd appreciate your feedback on today's session, and your input will help us develop future presentations. So without any further ado, I will hand it over to Nikki Conti to begin the presentation.
Thanks so much, Erin, and thank you everyone for joining us this morning. So as Erin said, we're going to spend a little bit of time talking about Health Connector coverage, and in particular, talking about some new savings that are here through the Health Connector because of the American Rescue Plan. So with that, I'll just take us through the agenda. We are going to provide you a little bit of an overview of the Health Connector. Some of you may be familiar with us, some of you may not. I'll touch upon the American Rescue Plan, then really get into details about how to get coverage through the Health Connector and try to outline some of the key points that you can expect. I'll spend some time on how to get free help with this process overall. For some of you, this may be entirely new. You may have never shot for health insurance coverage. Then we'll have some key takeaways where I'll just go through some reminders, share some resources, and we will leave time for your questions. So with that, let's talk about what the Health Connector is. So we're the state's health insurance marketplace, and we offer coverage for individuals, families, small employers. Essentially, we're here to provide access to affordable health insurance coverage for those who need it. So if you're wondering, okay, who are the folks that typically get health insurance coverage with us? It's people that don't have access to health insurance through other sources. So maybe they don't have access through a job or access through a spouse or their spouse's employer. A lot of people who apply for help actually qualify for savings. And especially now, there are more opportunities to get help due to the American Rescue Plan. Something I want to note, and I always think to myself, I need to remind myself to promote this, but people can also buy dental insurance through the Health Connector. So when you're thinking about health insurance, it's not just your health insurance coverage, but we also, of course, offer dental plans. So let's talk a little bit about the plans sold through the Health Connector. I think the most important takeaway from this slide is basically that all of the coverage sold through the Health Connector meets both state and federal standards for coverage. So you can rest assured in terms of knowing that you're buying a comprehensive health insurance plan and that you're meeting our state requirements. So if anyone is thinking, okay, what kind of plans are these? And I know at tax time, I need to show that I have health coverage. you would never be penalized for having coverage, for having health insurance coverage through the Health Connector. It does meet state standards. So I'm going to kind of go through each of these areas with you and explain some things that I think are most relevant for you to understand. All of our health and all of our plans are known as qualified health and qualified dental plans. So as I had previously mentioned, they meet state and federal standards, and you can choose from a variety of plans that are available from leading carriers in your area. Now, in the middle column here, you'll notice it says health plans with advanced premium tax credits. So this is really important, particularly as it relates to new savings available through the American Rescue Plan. So people with incomes in a certain range can qualify for more tax credits to reduce the cost of their monthly premiums. So I'll spend a good amount of time on this later, but just know that these savings are through advanced premium tax credits, and I'll explain that further. Something that is unique to Massachusetts are these connector care plans. So these are great health insurance plans, and people who are in lower income groups and also meet other eligibility requirements might qualify for this insurance coverage. And later, I will show you a bit more about the benefits that are available, the costs associated with these plans, and also we can just look more at those details. In the bottom left corner here, you'll notice catastrophic plans. These, we do in fact offer catastrophic plans, and those are available to people who are under 30 years of age or with a hardship exemption. What's important to note with the catastrophic plans is that they do offer a level of coverage for folks, but in the premiums are lower, but there is higher cost sharing on the consumer side when you use the benefits. So it's something to consider. It's available if people want them, but we do want to educate people on what enrolling in a catastrophic plan means. And then, as I had just mentioned, we do offer dental plans, and we have plans available for individuals, children, families, small employers, and that includes pediatric only or plans with higher or lower deductibles. So the American Rescue Plan, you can tell we're all excited about this. So this was just signed into law in March, and this law now delivers new and expanded subsidies to many Americans and hundreds of thousands of people in Massachusetts. So what that really means is it's going to help lower the cost of health insurance premiums when people come through the Health Connector. So with the Health Connector plans, there was lots of savings already available through the Health Connector because of the Affordable Care Act. But the American Rescue Plan now provides opportunities to get even more assistance right now, I think at a time when many people do need it. So let's look at what some of those sample savings might be. So the savings that are available are going to vary across Massachusetts. They're going to vary based on someone's age, where they live, and the health insurance plan that they'd select. However, we can take a look at some of these samples scenarios, and you might find yourself kind of visible in one of these. So for a 50-year-old in Worcester, let's just say their income is around $44,660. This person would be eligible for advanced premium tax credits. That right now, if they're enrolled in a plan through us, their premium may cost around $371. With the savings from the American Rescue Plan, their premium goes down to about $269, and you can see monthly savings there about $101. Also moving over to the right, you can see an individual in Boston. So I won't go through these all, but just to give you a little sampling, and you can see these yourself. But you can see in contrast, when you're looking at the 50-year-old in Worcester, comparing them to, let's say, a 30-year-old in Boston, maybe making a little bit less, that person is going to be determined eligible for a connector care plan. And we'll talk about that. And very specifically, based on their income, they, let's say they enroll in a plan type 3A, before the American Rescue Plan savings, their monthly premium was $89. Now their new monthly premium is $75.91. So, there's a savings there of just around $13, but still it is a savings. So we're very, very happy to be able to put these plans forward, these savings forward as people are thinking about their own situations and what kinds of coverage they might get, what kinds of savings they may be able to take advantage of right now.
Nikki, sorry to interrupt. Do you mind speaking just a little bit louder?
Oh, absolutely. Absolutely. Is this better, Erin?
I think so. I've gotten a few comments just that it's a little bit tough to hear.
Okay, hold on one second. I actually think it's my microphone. Is this better?
That sounds good. I will let you know if I get any other feedback.
Okay, great. I had it moved a little bit further down, so thank you.
Sorry.
No. Thank you for, folks, this was very interactive. So let us know if you need anything or can't hear us. It's really important. We want you to hear us. All right,
Thank you.
Okay, great. So let's talk about who can apply. So, okay. So again, we're in Massachusetts. We're talking about Health Connector coverage. So you should apply if you live in Massachusetts. You need to be a Massachusetts resident, a U.S. citizen, U.S. national, or otherwise lawfully present in the United States, and you don't have health insurance coverage. So this, as we had said earlier, coverage is available for people who don't otherwise have coverage. So if you are enrolled in Medicare, the state's Mass Health program, our Medicaid program, or other public health coverage, or you're offered affordable comprehensive health insurance from an employer, or if somebody is incarcerated, you would not be able to access coverage because you already have access to health insurance coverage. So when can you enroll? I don't know what your situation is. I know in past presentations, many of our participants were folks who may have been leaving a job or, coverage was ending from an employer or from a spouse. Know that there's something called special enrollment periods, and I'll touch upon that. But it's also important to note that right now we're in an open enrollment period, which basically means it's the time of year when anyone can apply for new coverage, or they can renew and shop for new coverage. So typically the Health Connector runs an open enrollment period from November 1 through January 23rd. However, given the environment that we're in, we've currently extended open enrollment through July 23rd, hopefully opening the doors and allowing Massachusetts residents to come in and get any health insurance coverage if they need it right now. So another key thing here, really important for all Health Connector plans, your health or dental coverage that you enroll in starts on the first day of the month after you enroll. So it can start as early. So today we are March, we're not in March, we're in April 15th. If you were seeking coverage for May 1, you would need to shop for your plan, select your plan. If you owe a premium payment, pay for that plan by the 23rd of the month, and you could start your coverage on May 1. Now, we encourage everyone to apply right away if you're seeking coverage, because you may find out, depending on what your situation is, you may find out that you qualify for Mass Health. Now, Mass Health coverage is not limited to starting on the first day of the month. It can start on, I don't want to speak too much about the Mass Health programs, but it can start much sooner than that. So let's spend a little bit more time talking about applying. There are 3 ways you can apply. You can apply online at mahealthconnector.org. You can also access our Spanish website. And so basically it's mahealthconnector.org /ES / So all of the questions are available. Our entire application, as well as our website, has been translated into Spanish. So if you'd like to go through that flow in Spanish, that is a possibility. You can apply by phone, or you can also apply with the help of a community partner organization or health center. So I'll spend some time later, but just know there are many people available who can help you get through this process or go through this process, and help is available for free. Now, I mentioned the Mass Health Organization, and that's important for us in Massachusetts because there is one application that you're completing to find out if you qualify for coverage through the Health Connector or coverage through Mass Health. So you only need to complete one application, but I do want to caution folks that you will get letters from both the Health Connector as well as Mass Health when you do apply. So don't be surprised. We heard from folks that it can be a little bit confusing because they sometimes, not sometimes, but will get, let's say, an approval from the Health Connector, and then a letter that says that they have been denied from Mass Health. Please keep in the back of your minds that Mass Health and the Health Connector are two distinct agencies, and the plans that you qualify for are separate. So, what do you need to apply for coverage? So, Social Security numbers for everyone who's applying, if they have one. If you have immigration documents for anyone who's a non-US citizen, if you have those, please have those handy when you're completing your application. There is a link on this slide deck that will take you to a page on the Health Connector's website that can show you some sample immigration documents. If you're trying to figure, if you've got some documents in front of you and you're like, I think this is correct, I'm not sure, you can compare and contrast and just confirm the type of document that you do have against what it actually is. Also, we're going to need information about income. So recent pay information is really important. So if you have it, we'd like to have copies of your last 2 pay stubs. Now, if you are currently collecting unemployment, we would be looking for the unemployment amount or the monetary determination. That's what it's technically called. That is on your award letter. We also understand that people who are collecting unemployment have access to an online system where you can actually see that award amount. So that's the information we need for our application. So essentially any information about your current income. Now, I know on past webinars, we've heard from folks who have said that they have just applied for unemployment. They don't know exactly how much they are going to be receiving from unemployment. So we don't want you to delay. If you need health insurance coverage, certainly come in, provide all the information that you're able to provide us through the application. You can always come back and update the application. And of course, as you can see noted here, if you don't have all the required information, we're going to send you a letter asking for more information if we need it. So I think I hope my sense of urgency is coming across here. Simply apply, gather as much as you have, because the more information you have, the better it is for you. But no, you can come back to your application and make updates. So on this slide, slide 15, this is what the landing page looks like on the application for individuals and families. So again, our website, mahealthconnector.org. Again, you're seeing the link to the Spanish version of the website. And remember, there is one application for the Health Connector, help paying for coverage, as well as Mass Health coverage. Now, I want to just pause here for a moment. Some of you, I'm going to be going through income guidelines, etc. Some of you may be thinking, okay, I'm in a different situation. I don't think that I'm going to qualify for any help, any savings. you can still come to mahealthconnector.org, and you can complete an application for coverage without applying for financial assistance. So just know you can still use our website, still shop for all of the health insurance plans that are available through us with all of the leading carriers in Mass, and you do not need to request financial help. So for those of you who are thinking about your income, you're unemployed right now, or you're not, when you complete an application, we ask you about your current income as well as estimated income for the entire year. So for current income, simply enter what it is right now. If you have unemployment income, include that. However, when you get to your expected yearly income, we need you to project a little bit about what you think you're going to make over the course of your year. So you need to consider how much you've earned so far. You want to add any unemployment amount, including any extra dollars you're getting each week, that that basically factors into what your whole picture looks like. For some of you, you may know that you're returning to work later this year, or in the summer. You also want to include that, and essentially you want to keep your income as accurate as possible, because you have tax liabilities associated with this, and I'll explain that a little bit. So at the beginning of the presentation, I had mentioned that there were more savings available through advanced premium tax credits. So we determine, or the application that you enter this information into determines the amount of savings that you get based on the information that you provide us. So you can get help paying for health and dental insurance. You're going to get that help in the form of premium tax credits. But at the end of the year, you are reconciling all of those tax credits on your taxes. So we would we really want to encourage people to reduce their risk of owing money back to the IRS when they file taxes next year. So knowing that there are more savings available, know that you do not need to take the entire amount of tax credits that are being offered to you. You can reduce that amount. So on this slide here, I talk about changing the tax credit amounts that you're getting. And there is a slider tool in the online application, and you can never take more tax credits than you qualify for, but you can reduce the amount of tax credits you take. And there are slides in the resources or in the appendix that I can go through if anybody wants to see where to find that slider. So let's talk more about getting help paying. So there are two kinds of help available. So I mentioned there is more advanced premium tax credits available at this time. So they will lower the premium amount you pay each month. Now, the way this works is the IRS sends your tax credit directly to your insurance company, so you'll pay less each month. And again, just want to reinforce that you can apply some or all of your tax credit to your monthly premium payment. Now, there's also the Connector Care program, which I mentioned was unique to Massachusetts. And the Connector Care program uses federal advanced premium tax credits plus state funds to help reduce the amount that you pay each month for your premium. Now, if you're eligible for the Connector Care program, know that it has low monthly premiums, low out-of-pocket costs, no deductibles. And depending on the plan type you qualify for, you could choose a plan for as low as $0 a month or $133 per month. So again, I'll step through some of those details later as well. And you may be wondering, okay, who's going to qualify for help paying for insurance? So similar to before, you need to shop through the Massachusetts Health Connector in order to get these. You need to not have access to a health plan with a premium that's less than 8.5% of your income. You need to live in Massachusetts. You need to be a citizen, national, or otherwise lawfully present in the US. And you won't qualify for help if you already have access to coverage through Medicare, Mass Health, or other public health insurance programs, or you're offered comprehensive health insurance from an employer, or or the person is in jail. Now, very, very specifically, I know some of you might be wondering, okay, what are the hard numbers to get help from the Health Connector? So in this first column, or excuse me, the second column of this chart, the first column you're seeing household size, the second column you're seeing connector care, that combination of state and federal help, and you're seeing something that says 300% of FPL. What that translates to is the federal poverty limit. So for example, a family of 3 who's making $65,160 or less could qualify for a connector care plan. Now, up until recently, we had a limit to 400% of the, so connector care plans, individuals in that income bracket, that still applies, okay? So in order to be eligible for connector care plans, people still need to meet or be in this area for income. Now, when we're thinking about advanced premium tax credits, the American Rescue Plan removes that income limit of 400% of FPL to qualify for help. So this is the first time that people over 400% of FPL may see some additional help paying for their coverage as early as their June premiums. So you might be wondering, okay, what does this mean for me? Can I get these savings in May? And you may be able to, yes, because we, as I mentioned, the law passed in March. We're in April right now. We've made some behind the scenes system changes. So right now, anyone whose income falls between 0 to 400% of the federal poverty level could in fact see savings through the Health Connector because of both connector care and advanced premium tax credits. During the month of May, we're making some additional changes so that people who are over 400% are going to start to see savings as well. So you may be asking yourselves like, well, what should I do in my situation? And it's just like before, our recommendation is apply now. If you think you may qualify for help savings, or you just want to see, there is no obligation to take our coverage. You can simply apply, get your eligibility from us, and see if you get the savings, you get these savings. And know that we're going to be checking in the coming months, we're going to be checking to see if there are more savings available for people. So that was a lot. I know I said a lot. So let's talk a little bit about choosing a plan and enrolling. So all of that was really related to what you might qualify for. Next, we're going to move into shopping. So once you know what you qualify for, you are going to want to compare your plans. So we have a couple of different tools on the Health Connector's website. And in fact, you are going to be seeing more tools in the coming months. But we do have a plan comparison tools that you can go on and take a look at. You can look at providers, you can enter medication preferences, and you can see if those health insurance plans take those, if the health insurance plans that are available in your area are affiliated with providers or cover medications. If you are strictly looking at pricing, you can go to the preview plans button on the application homepage, and you can just look at pricing. In terms of finding out if more savings are available to you, if you come back later in May, we're going to have additional tools that you can look at, and you'll strictly see the cost savings. But again, if you need coverage now, we really encourage you to apply now. When you are in the application, you can also look for preferred providers, your preferred prescription drugs, and this is basically what the tool looks like when you're in the application. So you can see in your search results page here, I've looked for, or I plugged in 2 particular doctors, a particular facility. They're displaying on the left-hand side, and the plans that are available on my right, and actually in real life, you would see several plans here. The plans that are available here would include these physicians, this facility, and if they don't, that's also indicated on the page so you can make a more informed choice when shopping. Now here, I just want to point out, you're going to get to a page when you're getting closer to enrolling in coverage, you're going to be reminded about whether or not you need to make a payment. Payments need to be received by the 23rd of the month. You can also pay online. So when you're in the application, you can go directly to the online payment center. So that's available. And yep, actually, is there anything else I want to point out here? No, I think I really just want to communicate that, there is a lot of information as you're going through these pages, but we do want you, if you feel comfortable completing an online application, we do want you to, kind of review all of the messaging that's on each screen. If there is messaging on the screen, essentially, we're really trying to convey an important point to you. Now, if you're thinking to yourself, I'm not somebody who's comfortable completing an online application like this, or you decide to get yourself started, but you're wondering, is this going to save me time? Am I making this more complicated? Do not worry. Anything that you do is actually going to move you forward, move you closer to completing your application. So let's talk about getting help through customer service and community partners. So free enrollment assistance is available through the Health Connectors customer service. You can also get free help through local community partner organizations. Our customer service number is listed here, 877-623-6765. If you want more information about our hours, we of course we don't have any walk-in support right now due to COVID, but you can go to the Health Connectors website to look more closely at our hours of operation and see any special hours. On the right-hand side here, you see a description about community partners. I want to convey that there are folks in the community that have been trained and certified, and these folks are either known as navigators or certified application counselors, and they speak many languages beyond English and can help somebody with their application, not only with the application, but answer questions about enrollment, and you can go back to them for ongoing support if you need them. Especially during COVID, it's recommended that you call ahead, you schedule an appointment for help. I do know that many of these folks are actually, hosting people over Zoom or just simply helping people over the phone. So whatever is most comfortable for you. And we know that some places actually have still continued in-person support. So just find out and see what works for you. Now there is a link at the bottom of this page, and you can click on that, enter some of your preferences, your zip code, and you can see who is available near you. Now, so let's move on to key takeaways and final reminders. So again, not knowing exactly who's out there listening to this, please know that losing employer coverage is considered a qualifying event, and it gives someone a special enrollment period for enrolling through the Health Connector.
For these people, I just want to convey that you need to apply, compare your options with us within 60 days of losing your employer coverage. Remember, you can apply online or by phone or with the help of an assister. And some people are going to get an automatic special enrollment period to shop and enroll right away. If you find yourself not in this situation, simply call customer service and ask them for support. They can help get you through. I want to note, it's not listed here, but do want to note that we are in an open enrollment period. So as I mentioned before, open enrollment is through July 23rd. So if you are seeking coverage or you have a family member who's seeking coverage, don't delay. Let's get this process started now. So if somebody is looking for coverage that starts on May 1, just remember that you need to apply, enroll, pay that first premium by the 23rd of the month before the coverage can start. If you want to, everyone's situation is different. You can apply now, choose a plan, and you can also choose to have your coverage start on the second month after you apply. So you could choose to have your coverage start June 1 if that's something you needed. And then lastly, as I had mentioned, there are a lot of free resources available to help you apply and choose a plan through the Health Connector. You can reach out to the Health Connector's customer service, or you can reach out to one of our community partner organizations. So please, if you need help, call today, make an appointment, and get the process started. So with that, Erin, Kayla, I'm going to come back to you and maybe we can answer some questions that people have.
Great. Thank you so much, Nikki. That was so helpful, such a wealth of information. So I will just get started on some kind of income, circumstances changing questions, and please continue to send in your questions through the Q&A functionality. As you hear others' questions, it may spark your own, so we will continue to monitor. But Nikki, so I'm going to start off with if a person has completed their application previously, say last year, they were receiving unemployment benefits, maybe working different combinations, income fluctuating, but they hadn't completed the financial help portion of their application. Should they come back and do a new application? And how will these new savings potentially benefit, or how will they know if it benefits them? So I guess a two-part question on how to proceed and what the American Rescue Plan could mean for them.
Okay. And so Erin, thanks for asking it that way. And I'm actually going to break it down into 3 sections. So keep me honest, okay? So first is we're talking about people who had previously applied. They applied for Health Connector coverage, but maybe didn't apply for help when they did this. So I would say first, you do not need to create a new account. I know you didn't ask about that, but I want to just stress that. You want to come into the account that you had previously created. If you have any problem with that, you can call our customer service to do that. But if you had not previously applied for help, we need you to do that. We need you to complete a new application, the one for financial assistance. That's really important. And that's important for a couple of reasons. One, if you, it asks you that path or that application is a little bit longer. You're being asked more detailed questions, and we're able to look into that application a little bit further and see if you could qualify for savings through Connector Care, if you qualify right now for additional advanced premium tax credits. So I think one of the things I mentioned was that the law passed in March, and we're in April right now, so we've been able to make some changes to our system. So right now, if your income goes up to that 400% threshold, you're going to be able to take advantage of savings as early as May 1. So that's great. That's for right now. Now, Erin, this is where I'm going to part 2. So I want you to keep me honest. So if it turns out that your income, your situation, when you take into consideration anyone who is on your tax return, so anyone who is part of your tax filing household,
If it turns out that your income is over that 400% threshold, but you have applied for help, next month, we're going to be doing some more programming. So we're going to be looking to see if more savings are available. So you may get another letter from us next month. I just want to alert people to that. So the key here is apply now. And then the third part, and Erin and Kayla, stop me if I'm getting too long-winded with this, but the third part is that unemployment insurance. So as part of the American Rescue Plan, there was a part of that law actually enables people who got unemployment for at any point during 2021 to qualify. Now, this I'm just talking about Massachusetts here, to qualify for a Health Connector plan at a Health Connector care plan. So at an even more affordable level. So that is coming. We're still working on programming that. However, the recommendation is if you are collecting unemployment now, or you've collected at any point during up until now, come in, complete that application. You're going to get those savings. Savings are going to be available to you soon, and savings that you would have gotten in some of the savings that you would have gotten in previous months are going to come to you at tax time. So I'm hoping that helps. And I'm just looking to Erin and Kayla, if there's anything else you want to add there, definitely want to open that up for you.
I think that's very helpful. I have nothing to add, maybe a follow-up question, but Kayla, I'll let you, if there's anything you'd like to add to that at this time.
No, that was perfect.
Great. And so, Nikki, I guess just more broadly speaking, calculating income.
Yes.
Obviously, last year we spoke about the unemployment kind of increase, the additional payments. There's also different forms of unemployment compensation related to the pandemic, maybe for individuals who traditionally may not have, been eligible for unemployment benefits previously, had access to new unemployment assistance. When it comes to unemployment compensation, or when it comes to calculating a person's income, should they draw any distinction between different unemployment benefits that they count in their income, or if they, potentially received the pandemic unemployment assistance, which, should that be included? How should they treat unemployment compensation as a whole?
Yes. Okay. And I may be looking to both of you for some help on this. I'll tell you what I know definitively. So someone is going to need to, if you're collecting, and all of these terms may or may not mean anything to you. So I think it might be when you're looking at your award letter, or you are looking at your unemployment statement online, I believe there's a column that says supplement. So if you are seeing a supplement, at one point last year, people were getting a $600 supplement each week. And I believe right now people are getting a $300 supplement that is going to last for several more months. That supplement needs to be incorporated into the unemployment amount that you're getting when you're calculating your annual income. So when you're estimating what your whole year looks like, you want to include any supplements or any additional dollars that you're getting through that source. I don't want to speak too much about what the IRS is going to do or not do on the other end, because we're not the IRS. But I think the Health Connector, needs to know that information so that we can properly put you in the right health insurance plan. Now for current income, and this is where I just want to get a check with both of you. For current income, I don't believe any of that needs to be added. We're strictly just looking for the person's unemployment income amount. Is that right?
Yes.
Okay, thank you. It's been a while, so thank you.
And so just to clarify, so that is with respect to that extra supplement, that little bump. But in terms of unemployment compensation more broadly, if you recall, the federal government kind of added additional programs. And so, individuals who maybe traditionally, if they were self-employed or not playing, maybe in the gig economy, they had access to new kind of unemployment benefits, but they should consider that unemployment compensation when they complete their application. Is that correct?
Yes, they need to consider it, but they need to, so this is where it gets tricky, and sorry if we're drawing a fine line, but I think the person who asked the question probably wants to know this. So our application is going to ask you questions about current income, and then it's going to ask you questions about annual income. So in the current income section, you don't need to include that information. But when you're looking at your annual income, or you're kind of calculating or projecting what your total income is going to be for the year, that's where you include it. Does that make sense?
Yes, thank you. That is
Okay,
very
great.
helpful.
Okay, great. Thank you.
And then additionally on just income counting, and I have shared
Yep.
the link. We do have a link on our website about how to answer questions related to income, and it has a worksheet. So I've shared that link twice, and I'll certainly share it again. But if somebody, how should somebody consider maybe bonuses or injections of income prior to their circumstances having changed? So they may be unemployed now, but as we look at the year as a whole, should a bonus or a one-time, injection of income be considered in the overall counting of income?
Yeah, so the answer is usually yes. And this is why we're asking about your situation now, and then your situation kind of overall. Because we need to know we're asking about current income, so we know kind of what's going on right now. But then when we're looking at, so for the Health Connector is trying to understand what the tax household has made for that calendar year. So if there was if there was a bonus that someone received, that money is going to get calculated into someone's overall annual. And so, Erin, I'm really glad that you shared the link about like how I enter, how to enter income, and you can look at all the different income sources that people are getting. So there are going to be some sources of income that don't factor in, while others do. So child support, things like that. There are things that will not factor into someone's so I apologize, folks, but we're looking at modified adjusted gross income. So if someone, and people are all different, some people are numbers people, so I don't want to discount that. If you want to figure out your situation, what your modified adjusted gross income might be before you even get into our online application, if you go to mahealthconnector.org, there's actually a fairly simple worksheet that lets you like plug in numbers, and somebody can kind of look at their own situation and say, okay, this is money I've received from my employer from January through January and February. I had gotten a sales bonus that month. Maybe you lost your position in March, so circumstances changed, but maybe you also have like interest or from certain dividends, et cetera, that you're expecting at the end of the year, because that's something that you usually get. I know it's not easy. None of us have a crystal ball to figure out it's not easy to figure out the annual income, but I'm hoping that worksheet can help people with their like situations right now. And I can't stress enough that you can enter income as you know it to be right now. And then we really encourage people to come back into the application as their situation changes and just keep the application up to date. This isn't like one and done. You can certainly come back in, make changes, adjust your situation, and kind of just keep that as up to date as possible. And I'm looking at Kayla too. Is there anything else you'd want to add there, or?
No, I think that's everything.
Okay.
Thank you.
Great, thank you so much. And so with that, we have had a follow-up question again on calculating income. Again, I have shared the link. So for some of these more specific questions, it may be helpful to use the worksheet that is on the website. But with respect to retirement savings or unearned income, is that something that should also be taken into consideration?
So maybe it could, maybe making this statement could help, because I think in the past we've gotten this question before and it's alleviated some concerns. Depending on kind of someone's age, they might be wondering, like what we're looking for. For those under, so typically when someone's completing this online application, it's for people who are 65 and under. So the Health Connector is interested in, the Health Connector and Mass Health at that age are interested in somebody's income, dollars that are coming into them. We're not looking at assets. If someone's over 65, there is a completely different process and a completely different application that they would be going through to complete that. So I'm hesitant to speak to anything very specifically because everyone's situation is different. So I would encourage someone to look at the list of what is, think of their own situation and look at what is countable, and then look at what can be excluded.
Absolutely. And just taking a look at the worksheet right now as well, there definitely is a line for retirement benefits, such as, IRA distributions, pensions. And so the worksheet will then walk them through what to do with that line. So that should be a great resource for individuals.
Great. Thank you, Erin.
Moving along, for households who maybe have adult children who are dependents under the age of 26, would they be eligible to apply as part of that household? And then I have a follow-up question, or how should they be treated, I suppose, adult children under 26? And then I'll have a follow-up question.
Sure. So adult children, so this is a question we typically get, and it's just a matter of what's going to make most sense for you and your household. If you have younger children, it's not inconceivable that based on your household size and your income, you may be eligible for a Health Connector plan, and the younger child may be eligible for a Mass Health plan. For an older child, older dependent that you are, and if everyone's looking for coverage, it is completely fine to complete an application. Let's just say it's you and your, adult child looking for health insurance coverage. That can be one application as long as they are part of your tax household.
Great. And so if someone has a dependent and they're, enrolled through the Health Connector, whether it be on their own or as part of the tax household, and they plan to move out of state, do we offer plans that have out of state coverage, or how would that work with eligibility requirements?
You're stumping me here. Hold on a second. Let me think. So I'm fairly certain that our health insurance plans cover when someone's traveling out of state. But our plans are for Massachusetts residents. So I'm just thinking about, I'm just thinking in practical terms. If I'm thinking about like a situation that I knew of. So it's like, okay, so there's parent who is covering themselves and a older child, then child moves away. If they're away for a little bit, that's okay. But once they decide to not live here any longer, I would suggest that they, disenroll in coverage, consider where they're living or where they're employed, consider their options that way. I don't know, Erin or Kayla, would you answer that any differently? Because I want to be mindful because there might be a slant I'm not considering.
Yeah, I think just generally in this situation, my first thought was to, check out that state and see what, they have available for their exchange or what the college, or if it is college, I can't remember. Yes, so, wherever they are, see what their options are there, especially if it's more of like a longer term move and not just a vacation or a short trip.
And I would agree with that, Kayla. If the intention is to reside in Massachusetts and you are going to be primarily in Massachusetts, I think, our plans certainly serve our residents well. But if you are planning to move out of state and be more of a permanent resident or a resident of the other state, I would recommend another state's exchange or their offerings there. So I hope that helps answer that question. And when it comes, staying on the topic of kind of plan offerings and whatnot, if a person contacts our customer service center or works with a navigator, are they able to get assistance in actually confirming that their providers are included in a certain plan, or what's the best way to go about making sure hospitals and provider networks are included in a certain plan?
So I'm wondering if I should I don't think I can show you. I don't think I'm set up to show you that, but I can show you, okay, I at least can show people this. So when you get the PowerPoint presentation, so I should have this, and you can also get to this information from the Health Connectors website. So if you go to mahealthconnector.org and you click on Resource Download Center under Help, so it's mahealthconnector.org, you would click on Help. There's a drop down and you can go to our plan comparison tool. What this plan comparison tool lets you do is enter a little bit of information. So if you're looking for a particular health insurance provider, a facility, or even let's say prescription medications, you can enter that information in and then you can see that the plans are, which plans are offering or are connected or affiliated with that provider in those facilities. We always recommend that if this is a provider that's really important to you, you should contact that provider and confirm with the provider as well, or contact the plan and confirm with the plan. And the reason I say that is the information that we display on our website and also customer service. Our customer service team is using this same exact information that you would be seeing on this plan comparison tool. I say to confirm with the carrier because the data that we get is coming straight from the health insurance carriers. And we understand that contracts change between providers and the health insurance carriers. It just may not have, that's not on those contracts aren't on the same cycle, let's say, that we are on. So it's always a good idea to double check with the carrier. I hope that's helpful.
Great, thank you. No, that is very helpful. With respect to, again, circumstances changing and individuals who may be leaving their employment, whether it's voluntary or involuntary, if somebody were to come into the Health Connector and select a plan now for May 1st coverage, and their circumstances change and they are eligible for more benefits in coming months, will they be able to shop for a plan that maybe is a little bit more robust or maybe meets their needs differently as it becomes more affordable? Are they able to change plans, or do they have to stay with the plan they select upon their initial application? And I know this could go a number of ways, but I did think it was a good question as circumstances are changing for individuals.
Yeah, so there will be flexibilities for people, and you're right, Erin. This scenario could take on very many forms, but there are flexibilities built in. So, for example, if someone came in right now and applied for coverage, enrolled in coverage, and then their circumstance, and so let's say someone came in, they applied for help. Applying for help is the critical piece here. You need to apply for help for coverage so that we can see if savings are available for you. So let's say right now you did not qualify,
but then something changed for you, or as you heard me mention, we're going to be making some back end changes in the coming months. If you apply for help and something either changes for you, or as we modify our programming in the next couple of months, we're going to share information with you, and you'll have some flexibility to, one, get the savings, and then also you may have an opportunity to change. You may have an opportunity to change plans if you'd like. So there could be, and this is why I'm kind of being squishy here. I'll just admit that I'm not like definitively say. I think what I want to get across is, if you need coverage, we would encourage you to apply and see where you are right now, and know that there are more savings from the Health Connector coming down the road. If your own situation is going to change, again, I would still encourage you to apply and then come back to the Health Connector and update your application.
And that could open more opportunities.
And that could open more opportunities, yes.
Great, thank you. We do have a few more questions. I know we're at time, but if we'll stick around to answer those. I'm going to go quickly to a dental question because I think it might be a little bit quicker to answer than the two others that we have.
Sure.
If somebody is enrolled in Medicare or Medicare eligible, are they able to purchase dental through the Health Connector?
Yes. The answer is yes. Just come on in, shop for dental. What you do need to know, if you already have your health insurance coverage from another source, you do have to call us to enroll in dental. So easy answer, but you do need to call.
Great. Okay. There have been a few questions about individuals who have heard about unemployment benefits in 2021 making you eligible for potentially a Health Connector plan or a low-cost Health Connector plan. What is the Health Connector doing with respect to this provision? When can it be expected? What would be helpful to know at this point?
So I am jumping to, as I said, you're going to get all of these slides. So we provided some additional content here, just so for anyone who, maybe wants like more detail and kind of, as I talked about things changing over the next couple of months, I'm sure this person's asking here, so when am I going to be able to get access to a $0 premium Health Connector plan, right? So the Health Connector is similar to the programming we put in place for May coverage. We're putting another level of programming in place. We're putting another level of programming in place next month. So anyone who newly applies for help paying for coverage, who was previously over the income limit, they may be found eligible for help. And then following that, we are working on making those modifications to our system to give access to a $0 Health Connector plan for anyone who got unemployment income in 2021. So it's just, it's going to take a little time, but we are rolling that out. More details will be available. What I would say is that there are aspects of the savings that are going to be available to that person at tax time. So for the months in which we were not able to give people those savings through a health insurance plan, some parts of those savings from the federal government are going to go to the person at tax time. And I know I really oversimplified that. So I don't know, Kayla, if there's any other definitive detail that we can share, please feel free. But I think I want to focus on what the person, I know the law recently passed and people are excited to get this benefit and get these savings. We're working on it, we're programming it, but they are going to be able to get the premium tax credit portion back at tax time, right?
Exactly. Yep.
Okay. I hope that helps, Erin.
No, I think that absolutely helps. You know, and this is certainly something that more information, you know, will certainly be forthcoming. So,
Oh, yes.
um,
And can I just mention that too? For anyone who's on the call, if you do apply for health insurance coverage with us, we're sharing a lot of information over email with our members. We're doing a lot of mailings. We really didn't talk about that here because our assumption is that people here aren't members, that we're assuming you're newly applying. But if you do become a Health Connector member and in any plan, any program, please do pay close attention to the mailings we send you, pay close attention to the emails that we send you, because we're keeping our membership updated along the way. So thank you for letting me do that PSA.
no, absolutely. Thank you. I think that is so helpful. We are certainly, yes, keeping our members informed. So if you are a member, expect a lot of updates, but helpful updates. I want to go back for a moment. We've had a few follow-up questions, and I think it would be helpful to kind of, you know, just talk through a little bit more about the plans offered through the Health Connector and
Sure.
with respect to out-of-state coverage. And it's my understanding, Nikki, and actually somebody has asked this specifically as well, that the plans really would provide coverage for out-of-state emergencies and emergency situations, but for somebody who may be, again, residing and, you know, regularly using coverage in another state, seeing providers in another state, our plans don't really cover that aspect. It's my understanding, and please correct me if I'm wrong, that for emergency services, our plans, you know, would be reliable coverage plans.
You got it.
But then I would also recommend beyond that, contacting the actual carrier to specifically understand, even within those emergency services, what exactly that looks like for an individual enrolling. And so again, to the question about, you know, being able to have a dependent on your health insurance plan under the age of 26, that is absolutely something that that the Affordable Care Act made sure would remain possible. But then it also does come down to each specific plan design, for lack of a better word, and what that each plan does cover. And so for connector plans, emergency services are typically covered out of state. But again, you would want to specifically understand what that means with each plan that an individual would select. And beyond that, our plans don't really cover kind of the more day-to-day, maybe primary care medical services along those lines. Is that a correct?
Yes, everything you've described is correct. But what I would stress for those folks maybe who live, I'm just gonna use like the New Hampshire or Rhode Island border as examples. Depending on that carrier who's available in that area, their network might expand across Massachusetts, over that Massachusetts line. But again, I would check with the carrier, because it's all about the network that carrier has contracted with. So I think it is fair to say, I think it's fair and accurate to say, you can count on our plans for emergency services when you're out of state, but for routine care, you need to stay within the networks that are contracted with these carriers.
Great. No, I think that's a very helpful and succinct way to say it. Thank you, Nikki.
Yeah.
And we still have some questions.
Sure. I can stay on if others can stay on. It looks like we've got more than 50 people staying with us. So it looks like,
no, these are great
so we'll
questions,
take it.
And please keep them coming. If you can try and use the question and answer box, it is just easier to track that way. But we're monitoring both the chat and the Q&A. So please continue to ask those questions. Can you just quickly provide the timeline again for when individuals who are over that 400% federal poverty level might be able to see if they're eligible for tax credits, when they can expect this?
Sure. And Erin, so I'm glad I kept this slide up here. And there's actually, and I'll go into some other information that I really didn't cover about the American Rescue Plan, but
Here you can see that right now expanded help is available to a lot of people. So I'll give you some insight to what's going on behind the scenes without getting too detailed. But basically right now, anyone who newly applies for help who has income under that 400% of 400% FPL threshold, if they're found eligible based on all their circumstances, they're going to see more subsidies available, more savings available to them now. So that part is now, that's happening. Now, next month, people, let's say next month, anyone who newly applies or anyone who had applied this month, but next month, we're going to be doing some additional programming that would allow people who previously were over the income limit, but due to the American Rescue Plan are now eligible. If they are found eligible for help, so if they're found eligible for advanced premium tax credits, they'll start to see those savings as early as June 1. So that's that piece. One thing I didn't touch upon, but I think it's important, is that I think I touched on it briefly, but if someone asks this question, this is relevant to the question. We're creating a new tool so that people can preview the savings that they might be eligible for. And so they'll be able to see their plans, they'll be able to see the premiums and their savings. That we're hoping is going to be available to the public by end of May. So if somebody wants to use that tool, that will be available at the end of May. And then the last piece of the Health Connector specific component that we're working on is that ability to provide people with a $0 premium Health Connector plan for anyone who got unemployment at any point in time in 2021. That is the last piece that we're working on internally. Something I did not go over, and I don't know if is it coming up at all in the chat stream in the questions, but I really want to, if anybody is on here and thinking about COBRA as an option, the American Rescue Plan gave people a $0 premium on COBRA, and that's going to be available, or that was available beginning April 1, and that's available through September of next year. So it really depends on someone's situation. It might be more beneficial to stay on COBRA. For other people, it may make sense just due to all the other cost sharing associated with COBRA. It might make sense to come to the Health Connector. But if you or someone you know is enrolled in COBRA and they're like, this is great, they can save money through September, fantastic. But then they know that beginning October 1, they're not going to be able to pay those monthly premiums. Know that we have a special enrollment period, or there will be a window after the federal subsidies run out that will allow people to come into Health Connector coverage at that point in time. So just, I want to be sure. I don't know whether or not anyone asked that. Doesn't seem like anyone did, but I just want to mention it. Because it is all related to ARP and benefits and health coverage.
No, but I think that actually opened up a good follow-up question, and actually we just received it. The $0, the subsidization of COBRA, is that only for people who are involuntarily leaving their jobs? If somebody voluntarily leaves their job, are they eligible for the subsidization of COBRA?
So we're not the COBRA experts, but I will turn to my colleague and see if there's anything she wants to add from what the employer is doing right now.
Yes, so there are some rules about who gets the subsidy. I would like to have this in front of me right now, but I think we have a slide on it. We definitely have FAQs on the website, but I believe it is involuntary leave or reduction in hours. We do have the FAQ on our website that has that information, so you can be certain, once you take a look at that. But the other part of this that makes it easier is that your employer has to give you a notice. So if you are eligible for this subsidy, either way, you kind of don't really have to worry about it on your end. You don't have to apply for it. Your employer is required to notice employees who are eligible. And it's sort of all on the employer to provide those subsidies directly. So you don't have to apply for the subsidy or anything like that. Either your employer or the insurer is just going to take care of that. So
All right, that's fantastic news. And Kayla, you also just mentioned something that we didn't mention, so I want to be sure to mention it. If you come to our website, mahealthconnector.org, you're going to see a pop-up that talks about the American Rescue Plan and new savings available. If you click on the read more, learn more, I can't remember what it says, but if you click on that, you're going to go to a page of FAQs. So what Kayla just mentioned about COBRA and detailed FAQs and things, that's all there for you. So really encourage people to take a look at our webpage, and there's a wealth of information there, because again, we know all the situations are different.
And I just shared in the chat the direct link to the American Rescue Plan page that we have developed that includes those FAQs. And I believe it's the bottom portion that speaks directly to different COBRA scenarios. So that may be helpful for individuals.
Okay, great.
yes. And just to confirm, it's for people who lost their job or had their hours reduced. So
Great.
Involuntary.
yeah.
Great.
Great. Nikki, you've mentioned a $0 premium a few times. What exactly does that mean?
Give me a little more context. Yeah.
I'm
So
sorry.
$0 premium. Yeah. So, okay. So I will say this. So the Connector Care Plan, oh, hold on. Maybe I can show you.
Yeah, so I know it was referenced with respect to the unemployment benefits, but we also, based on Connector Care eligibility, you could have access to a $0 premium plan. And I think potentially, even in the most simplest of ways, just kind of understanding what that means for a person.
You got it. You got it. And I thought this could be helpful to show as context. So basically, the way our health insurance plans are structured, I like to think of it as a pie. There's the cost of the premium, and then let's say you see a lower. How did I do that? I don't know how I did that. Sorry, folks. I was just getting my hands were moving. So I like to think of the savings that are available to people as pieces of the pie. So there is the part that is you're getting savings because of the advanced premium tax credit, so federal savings. Then there are state dollars that go into helping to save you money, and then there's your contribution. So our Connector Care plans are based on commercial plans. There is a price to those plans, but depending on your eligibility, your contribution each month for that premium could be as low as $0. So here you're seeing someone who's eligible for plan type 1, a 2A, you're seeing a $0 plan as the lowest cost plan. There are going to be other plans, particularly for 2A, there are other plans available in that plan type that may be more than $0 as a monthly premium, but essentially you can count on at least one $0 plan. So it's up to the person, really. Like, they can choose the $0 plan. They can choose not to have the $0 plan, and they would choose that. They might choose a different carrier because of a different network. So I want to acknowledge that. And then for Connector Care benefits and copays, I just want to point this out here. And sorry if I keep moving things. The benefits and copays. So regardless of which Connector Care plan somebody enrolls in, another thing that they can count on is that all of the copays that they pay for services are all standardized. So for example, if somebody qualifies for a plan type 2A, so a $0 plan, and I'm thinking about that person who's on unemployment, who in the coming months becomes eligible to enroll in a $0 plan. Something that could be of benefit to you is taking advantage of these savings through these lower lower cost sharing. So Erin, I hope, is that helpful?
I think that's helpful. Yes.
Okay.
Thank you so much. And so Nikki, we received a question just to clarify, and I think this is, something that it's not easy to communicate, and we've struggled with it ourselves in trying to make it as clear as possible. With the American Rescue Plan, so previously, if you had up to 400% of the federal poverty level, it was very nice, clean cut. You knew whether or not you were eligible for financial help.
Yep.
The American Rescue Plan, or is there any clear cutoff? How is somebody to know? Is it 500%? Is it 600%? And I know there are many factors that kind of go into the new definition of affordable under the American Rescue Plan. Can we speak to what the standard is now for a person to expect to receive or be eligible for subsidies?
Sure. So I'm gonna, I will leave this up, but then I will try to give my explanation of it. So here you can say, you can see that we're saying the American Rescue Plan changes the highest amount somebody must pay for their health insurance premium, limiting it to 8.5% of their income. So I think it's helpful to understand that on our side, we need to use a method to determine the subsidies a consumer gets. So we have standards on our side to I'm hesitating to get into explaining like a second lower cost silver plan and things like this. So maybe we could say that
Nikki, correct me if
yes,
I'm wrong, but
and you can add in. I'm very,
Yeah.
very willing to let either of you help explain this in a very simple way, because it's
not simple. So again, Nikki and Kayla, please feel free to chime in or stop me if I'm going too far. But essentially, premiums vary
yes,
based on age, based on region, based on a few factors.
you got it.
An individual under the American Rescue Plan, if they should have access to a health plan that is 8.5% of their annual income.
Correct.
If they do not have access to just one plan, it doesn't, that may not be the plan they want, but if they have access to a plan that is 8.5% of their annual income, the monthly premium or the premium is 8.5% of their annual income, they would not be eligible for financial help or these subsidies. However, as the plan increases above that 8.5% threshold, they would then become eligible for financial help to fill in that gap. So we're looking at the premiums available to an individual based on their age, based on their region, and then also essentially based on their own income, because that factors into what would be considered affordable based on the 8.5%. Is that
to them? Yes, I think that is a very good way to frame it. And I think another thing that's important there is that when we're talking about what's available to that consumer, we're talking about what's available to that consumer through the Health Connector. So
Yes.
the person has to otherwise be eligible to access health insurance coverage through the Health Connector. So if the person has an affordable offer of employer-sponsored insurance, they're not going to be able to take advantage of these savings. So I think I want to be sure that we're conveying that the person has to start by qualifying to enroll in a Health Connector plan for help with a Health Connector plan, and then that's how we work with that 8.5% of their income.
great?
Kayla, how did we do? or
did
folks
great.
on the line, how did we do?
And again, it is tough because it's not a clear line anymore. It kind of takes into consideration, and I think with the best, the best of intentions, but
Correct.
makes it certainly more difficult to communicate, more difficult to break down, and more difficult to just glance at a chart and say, oh, this is what I'm eligible for, because of those factors that vary.
Yeah, and to speak directly to the question about like so what income range is the cap at? I don't know where I fall. There is no cap anymore. So anyone over 400% may get subsidies, but these factors that Nikki and Erin just explained will determine whether you do or not. So it's sort of like a phased out help paying the higher income you go, and there's no definite cutoff. It just matters, it'll rely on all these factors that were just explained and what's available to you.
And before we leave this thought, even though the affordability might be set off of a silver plan, a person is not limited to selecting a silver plan. They can they use these tax credits towards a gold plan or a bronze plan? And this is getting very technical for people. So let's just say plans that may have lower premiums, but higher deductibles, or, is there flexibility on how a person can use the financial help, even though it might be based off of the plan you have, like the lowest cost plan that may be available? Are you able to take this financial help and buy a different plan?
You can take these savings and you can certainly apply them to coverage. See, I'm hesitant to respond to. There is flexibility. We're not tying the consumer to enroll in a particular carrier or a particular plan. I think
that's the answer there, Nikki.
Yeah. I want to be sure people understand that we're not trying to box you in to something.
So sorry, go ahead.
Go ahead.
I was just gonna say,
I'm thinking about a consumer's perspective.
Yeah.
Like, does this mean if I take these dollars, does this mean I have to enroll in an X, Y, or Z? I want to be upfront and say, if you qualify for connector care, you're going to be limited to the carriers that offer connector care plans. But if you don't qualify for a connector care program, you qualify for advanced premium tax credits, you do have more flexibility. There are more carriers that you can choose from to apply these credits to. Does that help?
And I think absolutely.
I'm sorry.
No, that's great. So if you're kind of outside of connector care, maybe newly eligible for these advanced premium tax credits, or you're getting slightly more because you are in the higher bounds of the income threshold before, right around maybe 400%, what have you. You are not required to apply those advanced premium tax credits and enroll in that lowest cost plan. You can take whatever you get based off of the lowest cost plan outside of connector care and potentially apply them to a plan that may be more expensive, but you will not be getting that financial help or advanced premium tax credits based off of the more expensive plan. The amount you receive will remain the same because it is based on that lower cost plan, but you are free to kind of do with that additional funds what you wish with them through the connector.
Yes, and the other important thing not to forget here, folks, is that these are premium tax credits. They're tax credits, so there is a full amount that you qualify for. You can't go above that amount. You can reduce that amount, though. You can reduce that amount. So if things are in flux for you, you can certainly take that into consideration and adjust according to what you feel most comfortable with.
Great. On the income question, is it correct that the Health Connector only looks at income and not assets?
That is correct, yes. So I had mentioned, yes, assets are for people 65 and older. That's when that assets factor in.
Perfect. And then for the purposes of calculating income, this is modified adjusted gross income, correct?
You got it. You got it.
And then lastly, if somebody were applying, how do we know if they have access to Mass Health? Is that something they would already be aware of? If they're completing the application, is our system going to kind of, let them know if they aren't eligible based on access to Medicaid?
That is correct. So we share a system with Mass Health. So where someone is going to be eligible for either or.
Okay.
They're not going to, yes.
And I think that is all of the kind of more broad questions. I believe we are, for individuals who had pretty specific questions, we are getting in touch with you to recommend potentially reaching out to a navigator to have, specific questions answered. But Kayla, is there anything that you saw that that I have not addressed?
No, I think that was it. I think my only closing thought would be to definitely reach out to a navigator if you have some questions that you feel like are sort of individualized and haven't been answered. Navigators are super helpful and will guide you through the process.
And just so that my only closing thoughts are, if you do need coverage, I would suggest you apply as soon as possible. I agree with Kayla. Our navigators are incredibly helpful. And I really want to thank all of you for staying on the line with us for quite some time to go through these questions. So a big thank you to Erin and Kayla for helping us. A big thank you to you for joining us, and thank you to Erin and Kayla for helping and assisting with all the questions and keeping us in order.
Excellent. Well, thank you so much, everyone, for joining us. And we will be sending around this presentation via email over the next day or so. And it will also be posted to our video library, and we'll include a link to that as well in the email. So have a great day, and thank you again for joining.
Thank you. Bye-bye.
Thank you.